Rachel Perkins. I'm the Education and Outreach Specialist for Texas Oncology Foundation. I'm the one that y'all keep getting emails from. Hopefully you're not annoyed yet. If you're a cancer patient, caregiver, professional, and want to educate yourself about the cancer world, we invite you to join us on Fridays. This is our last one. And Erin Dean is going to have a workshop with us today on nurturing your pelvic floor and sexual health with cancer. All right, so I get the pleasure of introducing Erin Dean. She's a doctor of physical therapy who specializes in pelvic health, lymphedema therapy, and oncology rehabilitation. And she's currently undertaking a sexual counselor certification. She has given multiple presentations on pelvic health, especially in the oncology setting, and developed the pelvic floor program at Texas Oncology. So she's amazing in every single way. She has a background in yoga and incorporates breathing meditations and visualizations into her treatments as needed. So Erin Dean, if you want to go ahead and take it away for us today, we'd love to start this workshop with you.
So last week we talked a lot about pelvic pain and sexual difficulties and treatments after cancer, with cancer, but specifically medically induced menopause. Today it's going to be more about like urinary issues, incontinence, urinary urgency frequency, and then some colorectal stuff too. But I actually listened to this podcast called Wiser Than Me, which if you've never heard of it, it's really empowering, I think, for people, really any woman, but especially women who are kind of reaching menopause or postmenopausal, because it's Julia Louis-Dreyfus from Seinfeld. She's interviewing these kind of older women over 70, 80, 90 about their lives. And I listened to this one. I thought I would share this quote with y'all that I listened to this week from Gloria Steinem, who you likely know, but she's one of the leaders of the second wave feminist movement in the 60s and 70s. And she's 90 now. And she said something that really, menopause has, like I said last week, it's not talked about. It's like a hush hush. There's so much, like, people are, I don't know, it just doesn't have a great, it doesn't feel good for most people to go through that transition because society doesn't make it feel good for us. But this made me feel more excited about going through it personally. I'm kind of at the very beginning stages. She said, it's a time of freedom. So this is about being older. It's a time of freedom. It resembles before the feminine role descended upon you when you were a little girl climbing trees. Only now you have the spirit back of the little girl climbing trees, but you probably have a house room of your own. And then I added more autonomy is basically what she's saying. So you're kind of free from society's like pressures because you get to be that free spirit again, which I thought that was really sweet. So anyway, onwards. Okay. So by the way, and I said this last time, this presentation is geared towards people with or who've had uteruses, but their partners can learn more about how to support them. So if your partner is here with you. Also, people with other pelvic cancers may have some of these symptoms and will benefit from this information as well. As I discussed, we're going to kind of talk a little bit about colorectal issues. And even if you didn't have colorectal cancer, you still might have some of the issues that are common with those folks. So, all right, so our outline for today, we're going to focus on the first two boxes this time. Like I said, last time was more pelvic pain, painful intercourse, and sexuality issues. This time we'll talk about urinary urgency and frequency, and then incontinence or leakage, and then also some bowel stuff. So I just want to push pelvic floor physical therapy a little bit. This research study, it was a randomized controlled trial, which basically means it's one of the top tier levels of research, and it was done on 206 postmenopausal women. Half of these people got intravaginal estrogen, so like estradiol, you insert it inside like we talked about last week. And then half got the estrogen and pelvic floor therapy. So both had significant improvements in vaginal dryness, but 10% of the people with estrogen alone had improvements in leakage, and a whopping 74% with estrogen plus therapy had improvements in leakage. So the stuff, and I'm kind of like just dumping all my knowledge of this stuff onto you today. And some of it will be in the handout that we provide so that you don't forget. But therapy works. So yeah, and it rocks is what I said. So this is our crash course. Okay. All right. So urinary urgency and frequency. So menopause and pelvic radiation can both cause these issues to start up. When you have radiation to the bladder, it can, especially during radiation, you can actually have something called radiation cystitis, where you get kind of UTI-like symptoms. And those symptoms, because of the changes to the bladder lining and also the muscle around it, can cause a little more, like the bladder muscle isn't as supple as it was. And so you're getting a little less common normal movement of the bladder muscle. So it can cause these weird symptoms. But luckily, these exercises that I give you will likely help even so. And then menopause, there's receptors on the outside of the bladder for estrogen. So when there are fewer receptors, when there's less estrogen in the system, the receptors aren't getting filled, and then the bladder is more likely to spasm, which gives you that sense of urgency and frequency. Not to say that your bladder's full and you need to go. So that's where this educational piece that we're going to talk about really comes in handy. And here's the thing. So even if you're already menopausal or you had been and then you went through cancer treatment, say you have breast cancer and you're getting anastrozole or letrozole or one of those hormone therapies, the remaining estrogen in your system is now being depleted. So you have now like none. And so that's going to make those symptoms worse than they were even if you were already menopausal. Okay, so just FYI, quote unquote, normal, healthy bladder habits are drinking enough water. So that one's very important. So some say half your body weight in ounces of water per day is normal. So say you weigh 160 pounds, that means that you need about 80 ounces of water a day. So that's a lot more than most people I'm seeing are getting. And then if you're sweating because you're exercising or you live in Texas and it's hot, you need more than that even. Some others say that thirst should guide your drinking of water, but I know a lot of people who, for whatever reason, they don't like water. So then they just are so used to not drinking it that they don't have that thirst clicking on their brain to go seek out water. So I think it's important to know what normal is, quote unquote. It's normal to urinate about 7 times while awake during the day, or every 2 to 4 hours is normal. It's normal after menopause to get up 0 times or 1 time to pee at night. My mom, for example, 71, she's claimed her whole life to have a small bladder. And now, she used to wake up once at night when she was younger, and now she's waking up 2 or 3 times, and it's affecting her, ability to get a good night's sleep, which affects fatigue and desire to exercise and be healthy and all of those things. So it's actually something that can be trained. All right, so we'll talk about that. You can train it during the day so that nighttime your bladder's not freaking out as much. It's also normal to feel an urge to pee and then be able to wait before urinating, walking to the toilet calmly without leakage or fear of leaking. I'm sure all of you experienced that at one point in your life. That's what's normal. So if that's not what you're experiencing right now, that's probably why you're here, and we're going to talk about how to fix it. Okay.
Hey, Erin, can you just move your mouse off of the screen?
Oh, yeah.
Thank you.
Is that better?
Yes.
Okay. So I'm going to talk about the bladder. This is really helpful to understand. All right, so you can see the picture here, but here's my little bladder. So we have we have the bladder, there's a lining on the inside of the bladder, and there's a muscle around it, okay? So normal bladder function is you drink some water, and after a good period of time, so not right away, it's got to go into your bloodstream, and then it gets filtered out through the kidneys, and then it becomes urine, and then it goes into your bladder. So by the way, if you drink water and you have to pee like that, some people are like, it just moves through my system fast. That's not what's happening. Likely it's that you've become used to drinking water and having an urge, and so you're assuming that's what's going on, and you can retrain that. Okay, so it takes a while to get into your bladder. Anyway, normal for it to fill up about halfway, and then the bladder muscle squeezes a little, okay? And so you're thinking, I could probably pee in an hour-ish. And then it fills up more, and it squeezes harder. And you're like, I might go in 10 minutes after I finish this, blah, blah, blah. And then it gets really full, and it might become a little uncomfortable, or you feel pressure in there, but you can still hold it, okay? So what happens with urgency is, for whatever reason, either because of radiation or because the bladder's spasming because of estrogen loss, or just because behaviorally you've trained yourself to pee every time you have any urge. Someone laughed. Yeah, you know what I'm talking about. Then you get a little bit full and the bladder squeezes like crazy, right? And you feel like you have to pee right now or you're going to leak because your bladder is so full, but then you pee and maybe only a little comes out. Or maybe it feels like a lot comes out because you're used to peeing every hour, so for you that's normal. FYI, that lining inside the bladder can get irritated. So it can get irritated with radiation. It can also get irritated by certain foods and drinks, or by not having enough water in it to kind of dilute whatever it is you're eating or drinking. So when the bladder lining is irritated, that makes this squeeze happen. So it gives you an urge, which maybe you've experienced, feeling like you're about to get a UTI, and then you drink a bunch of water and you feel better. A lot of people have experienced that. That's likely because there was something and it was getting irritated for whatever reason, and then you basically diluted that thing and that was on the bladder lining, and now everything's fine. So some bladder irritants are, for example, sparkling water. This one hurts everyone's feelings. My mother-in-law told me, a lot of personal stories, I guess, today. My mother-in-law told me once, she's like, I just pee all the time on myself, and I don't know why. And I said, well, tell me what you're drinking. She's like, I mean, I drink water all day. I said, what kind of water? She said, you know, those like flavored sparkling waters. And I was like, do you drink any normal water without flavored sparkles? She said, no. Like, well, there you go. So sparkling water, the carbonation in it, the carbon dioxide, actually irritates the bladder lining and makes it squeeze. So she stopped doing that. She now drinks like naturally flavored water, and she doesn't leak anymore. So that was pretty simple, luckily. So yeah, so sparkling water, coffee and tea, caffeine, they can be bladder irritants, but they're also diuretics, which I'm sure you've heard. So it's actually sucking the fluid out of your tissues and making you pee it out. So it's normal to drink a cup of coffee and then you're like, oh, I got this crazy urge because you got to pee because your bladder is actually full, but the lining is also irritated. Also, some spicy foods, sometimes like citrus can do it. So some people are really sensitive to certain bladder irritants. I don't often see these people because I guess people who come see me have more complexity, and that's not the reason they're coming in. But if you're having a hard time, you might rule out like natural artificial sweeteners can cause bladder irritation. Alcohol is also a diuretic and a bladder irritant. So what I tell people is, I'm not going to tell you to stop drinking your coffee unless all you're drinking all day is coffee and then soda, or coffee and then wine. That's probably not the best thing for your bladder. But if you're going to drink your coffee, double fist it, right? Coffee in one hand, then take a sip of water. It's better for your teeth anyway, to be honest. So you're getting as much of one thing as you are of water. So it's diluting it inside the bladder, so the lining isn't as irritated. You're not going to get as strong of a squeeze. And you're getting more water. Easy, right? Okay. I think that's all that. So there's this, if you are having, I'm sure plenty of you are having some issues with this, just because that's, well, just because this is the main topic for today. So I'll give you a bit of a detailed treatment for this one, okay? So if you're having issues, say you're peeing every hour and your urge is really strong, or maybe you're rushing to the toilet and you're peeing, leaking on the way to the toilet, this is what you do, okay? So let's say you're peeing every hour, about once an hour. I would try to, you're basically thinking of your bladder as a little puppy dog, little baby puppy dog, and you are retraining this puppy dog to listen to you, okay? So I bet you know, a lot of people are like, I put the key in the door and then all of a sudden I have to pee really bad. So if you have a new puppy dog and you're taking it on the walk around the block, and then all of a sudden it sees your house and it starts to run, right? Same kind of idea. So you have to turn it around. It's annoying to turn it around, but you have to do that so that it'll stop running, and then you walk the other way, and then you calmly get it to go back, and then you can walk to the house. Same thing with your bladder. So you time your voiding for once an hour. We start there. So you wake up in the morning, and these details are important, okay? So get your scribe to write it down for you. You wake up in the morning and you pee. And then if you have some sort of fancy device that can set an alarm, you set an alarm for an hour and you pee on the hour, even if you don't have to. And if you do have to pee before that hour comes up, or the alarm goes off and your body's like, oh, yay, I get to go. You calm down the bladder before you walk to the toilet, okay? So you wait till the hour comes up and then your alarm goes off, and then if you start to get an urge, you take a deep breath, calm down your nervous system. You sit down if you can, because that puts pressure on the perineum, that space between the anus and the vagina or penis. It puts pressure there, which helps you, it helps the muscles do what I'm about to tell you. And then here's the key. You squeeze and relax your pelvic floor muscles like you're stopping pee. So by the way, when I squeeze and relax my pelvic floor, I'm doing it right now. Can you see that I'm doing anything? No. So it's not like this, right? So you're squeezing, so you have to pee. Oh my God, I have to pee. It's only been 45 minutes. What do? Take a deep breath, sit down, squeeze and relax your pelvic floor 5 times. That is a reflex, an actual reflex in your body that makes that bladder muscle relax. So it stops your urge physically. And then you distract yourself until your alarm goes off, or say it just went off and then your body freaks out. Calm down the muscles, distract yourself. I say count down from 100 by 7s because it's hard, and then calmly walk to the toilet. If the urge comes back onto the way to the toilet, or you see the bathroom, you see the toilet, and your body's like, yay, then you do it again. You take a deep breath, maybe cross your legs, squeeze and relax 5 times, calm down the urge. You are retraining your bladder, okay? It takes time, and it's your brain and the bladder connection, and you want to control it. Then you sit on the toilet and calmly empty, okay? So this is if you peed every hour on the hour, or sorry, this is say if you're peeing about once an hour. Say you're one of those people that pees every 30 minutes or every 15 minutes. I met someone like that the other day. Then you start this a little easier. So maybe you start every 30 minutes peeing on the hour, even if you don't have to. Remember, you go every time your alarm goes off. But if you're peeing once every 2 hours or something like that, if the urgency is really high, then you might time it for 2 hours and you still do that urge deferment every time to calm it down before you walk to the toilet. Again, normal to pee every 2 to 4 hours, but it's not normal to leak on the way to the toilet, okay? There's one more thing I wanted to say about, okay, yes, you stop this before you go to bed. So you don't keep doing this all night in the middle of the night, waking up every hour. You stop this before you go to sleep. And research shows that bladder retraining like this helps nighttime urgency so that you don't have to get up as many times at night. And I've seen that time and time again with patients. So you do it all during your waking hours. At night, you just let whatever happens, and it's likely going to get it better. It's helpful if you stop drinking a couple hours before bed, but that's not the only solution, okay? All right. Also, feel free to ask questions. Just jump out with it. You can unmute yourself. Like I don't mind being interrupted if you want to interrupt me. No? Oh, Joan? No.
Oh, I didn't say anything. I'm sorry.
Okay, you just lit up, so I thought maybe you were thinking about it. Okay, that's all right. I'll keep going. You can save your questions for the end or whatever you want to do. Leakage happens to many people for a number of reasons. There's two kinds of urinary leakage. There's urge incontinence and there's stress incontinence. Some people have a mixture, a combination of both. So urge incontinence is due to what I was just talking about. You have an urge to urinate, and then on the way to the toilet or with that urge, you're leaking, okay? You can imagine that that would happen if this bladder muscle was squeezing so hard, because your pelvic floor has to hold that back, right? It's supposed to, when this squeeze is really hard, your pelvic floor, in theory, you're sitting on the toilet, the pelvic floor relaxes. But if it's freaking out, your pelvic floor is like, you know, having to hold it back so you don't leak. So some people will have this happen if there's not enough strength in the pelvic floor or coordination of the muscles. I actually see sometimes there's pelvic pain and chronic tension in the pelvic floor, which actually spasms the bladder even more. So people then, they learn to relax the pelvic floor muscles and the bladder kind of calms down too. And then you can imagine if this is relaxed pelvic floor, if maybe you were here, if you're trying to hold back urine, you don't really have as much of a squeeze. If you're in a neutral position, then you have more power. So I would advise against just doing Kegels to fix any problem, because sometimes if you have pelvic pain, any pain with any penetration at all, then Kegels are likely not to help you. That's really important to know. Unless you do them and you learn to fully relax after the squeeze. Okay, I didn't mean to bounce. Don't bounce when you Kegel, sorry. Okay, thanks Rachel for being your face on there. That's really helpful. When you smile, it makes me like, okay, someone's listening to me. Okay, I know you're all listening, but all right. Yeah, I kind of talked about this second point already. When the muscle around the bladder squeezes harder than the pelvic floor can counter, then there'll be leakage, right? And if that bladder is really spasming and really squeezing hard and really irritated, or it's used to squeezing really hard, then I mean, even someone with a lot of strength can have a hard time holding back urine.
I think we had a question last time that was talking about like sneezing and leakage. Do you remember that?
That is the second point. That is the second point right here. Actually, I think that person asked about sneezing with leakage when you have an urge too. So stress incontinence is when you leak with exercise, coughing, sneezing, or other movements. And if you add in urgency to that, so you can imagine if you're having an urge and you're having to counter that and then you sneeze, like you're screwed, right? Because this is definitely not going to be able, that's a lot. Like I don't even think I can do that, honestly. So not that I'm the best, like I had a baby and there's a lot going on down there too. So, but I usually don't leak. So what you do for stress incontinence, so if that's you're having the urge and then you sneeze and then you're leaking, I would work on the urgency portion that we just talked about. The stress incontinence, if you're leaking with exercise, coughing, sneezing, that's a little more challenging to just talk about, but I will go over some exercises here in a little while where I'll help you pinpoint the right muscles to work on. And we'll go over a specific technique for holding back urine during sneezing and coughing. But especially if you're only, say, I've had patients who they get back to running after whatever trauma, a time of inactivity, and they're leaking all of a sudden with With running, that's more complex because they might even not leak any other time, but they run and then that's more complicated. See a pelvic floor PT if that's you. But we'll talk about the coughing and sneezing in a second. Yeah, right here. So what do? I already talked about bladder retraining and urge deferment. The urge deferment is that breathe, squeeze and relax 5 times, distract yourself, calmly walk to the toilet. And I have that written out on the handout for you, by the way. Okay, so I mentioned that if you already have if you're having pelvic pain, that it's not necessarily the best thing to do Kegels. Kegels are pelvic floor squeezes, right? But if you can do them in the way that I'm going to describe, then it will actually be okay for you. So let's all together sit on our, well, just sit down with a neutral spine. So you feel like you sit up tall, basically, so that you can feel kind of maybe the pelvic floor muscles against the chair. You might have to scoot your tissue out of the way so you feel those sits bones and your pelvic floor is right in between those sits bones. Actually, I have a model. This will maybe help. Okay, model, everyone. Just for reference, this is a anatomical female. Anus, vagina, urethra, and clitoris is up there. Okay, so these are the sits bones. If you're kind of on the thinner side, you might feel those when you rock side to side. The pelvic floor muscles are between those sits bones, everything between those sits bones. Your butt muscles, like your glute max, is out here. That's why if you think you're squeezing your pelvic floor and you're like bouncing when you do it, you're actually squeezing your glute max, your butt muscles. So you should feel movement between those 2 bones. Okay, so we're sitting so that we can feel them on the chair. You might have maybe a towel behind your spine so you can sit up tall without having to work too hard, or a pillow. I'm gonna let y'all do that. Okay. So just try, without holding your breath, squeezing your pelvic floor like you're stopping pee and a fart, and then let it go. Okay, try it again and put your hand on your low belly. You don't want to feel your low belly engage, okay? And you don't want to bounce. So low belly stays soft. Squeeze your pelvic floor like you're stopping pee and a fart. You're breathing, take a breath, keep squeezing and let it go, okay? That's a proper Kegel. Here's the deal though, if you have pelvic pain, excuse me, some people with pelvic pain, they squeeze and they let go. They're like, I don't feel the let go part. All right, so those are the people, if you can't feel the let go part, that means that you're probably not letting go all the way. And so for you, it's possible that the more you squeeze, the tighter your muscles get. Everyone's different. I have some pelvic pain patients who they squeeze and then their muscles finally let go. So try it for a little while here. So you're squeezing and then see if you can let go, and then try to let go a little more. Okay, try it again. Squeeze, they lift up off the chair and let it go. They go down and let them go a little more. They go even more down. All right, so if you were in my office right now, I'd ask you what you feel, but you're not. So if you can feel the up and the down fully and you feel like, okay, it's hitting the ground, then you're probably okay to do Kegels, especially if you're not having pelvic pain. So let's try this. You're still sitting up tall. Sit forwards just a tiny bit, so come closer to me, and squeeze like you're stopping pee only. So you should feel it in the front part of the muscles. There's 2 layers of muscles. It's kind of like maybe moves the clitoris down a little bit, or the penis, and then relax, and then rock back and tuck your, here, let's see if you can see. So I was leaning forwards, I squeeze like I'm stopping pee, and then I rock back and tuck my tailbone, so you're sitting right kind of in bad posture, and I'll squeeze like you're stopping a fart and let it go. Okay, try it again. Sit forwards, squeeze like you're stopping pee, and let it go. Roll back, squeeze like you're stopping a fart, and let it go. So you're actually feeling the 2 different layers of muscles when you do that. You're feeling stopping pee, that's more like that first layer of muscles. And then the stopping the fart, you're getting it around the anus, but also those deeper muscles might be lifting up towards your head. So they come this way. I want you to be able to let it go all the way though afterwards. Super important. So now let's try it, sitting straight up. See if you can isolate those two different parts. You will actually feel both engaged just a little because there's not perfect isolation available to you, but you might be able to feel a slight difference between them. So sitting straight, you squeeze the front like stopping pee and let it go all the way. And then squeeze the back like stopping a fart. You'll still feel the front a little bit, but it should feel more like the back, and let it go. Try one more time. I'm breathing normally. Look at I'm talking and I'm doing it. I know y'all are like, well, you have experience, but you'll get better if you practice. Okay. So some people, they have leakage and then they do this with me and they're all of a sudden the next day they come back in, they're like, oh, okay, I'm fine now, because their body just, especially with radiation or any sort of surgery, their body just kind of forgot how to work right. Okay, so if you can work on this little thing, then you're likely to get at least a little improvement, if not a lot. So, by the way, also, people who are having urinary incontinence, you want to be able to feel that front part squeeze and isolate that. If you're having fecal incontinence, you want to be able to feel the back part squeeze. So if you feel one stronger than the other, or you feel only one and not the other, work on that other one, right? So I have a guy with fecal incontinence and we're really focusing on the back ones, just like a little, it's like the sphincter's closing and opening. And we're working on that with him. And that was a sensory thing for him. Again, at first he didn't have it and now he does, and he's not leaking anymore. So let's talk about the coughing, sneezing thing. All right. If you're coughing and sneezing and leaking, it's because there's so much increased pressure inside your belly that when you cough and sneeze, that's what happens. It's like the whole system pressurizes, and then your pelvic floor can't counter by squeezing hard enough to hold back urine. Okay. So you can practice by squeeze before you sneeze. So you inhale, relax your stomach, squeeze your pelvic floor, cough. Okay, try it again. Inhale, relax your stomach and your pelvic floor relaxes. Squeeze, cough. So that's called the knack. I don't know why, but I think I talked about this in the handout too. I think I do. Anyway, so again, you inhale, open, squeeze, cough. Okay. And I would just practice, do like 30 of those and take a break and do 30 more. And every time you cough or you're about to sneeze, you can think, oh my God, I got to squeeze first, squeeze. And then you cough and sneeze. It takes practice. It's a habit in your body that you've been doing wrong for who knows how long, however long it's been that you've been leaking. It takes time, many repetitions to get that habit recreated in your body. Okay. This is another thing. So I'm just going off the cuff here. So treatment for these issues, it depends on what the issue is, but urge incontinence, bladder retraining, urge deferment, stress urinary incontinence is more that the knack, pelvic floor strengthening, coordination is kind of understanding how to engage different places and having the ability to squeeze and relax. That's coordination. For some people, because the pelvic floor and the breathing diaphragm, they move together. When you inhale, when you exhale. So pelvic floor, breathing diaphragm, deep abdominals, deep back muscles, that's your core stability. So some patients have a lot of weakness in their deep abdominals and they don't have the ability to hold back urine. Or sometimes weakness in the deep abdominals makes your pelvic floor have to overactivate and you have pain with sex. So having some understanding of at least how to activate these muscles, and you can incorporate that into whatever exercises you're doing can be helpful. Okay. So deep abdominal activation. I'm gonna actually stand up. Okay. So you've got, just a second. You have 4 layers of abdominal muscles. You have the 6-pack layer that runs this way on the outside. Whether or not you have a 6-pack that you can see, you still have those muscles. And then you have obliques going one way, another layer of obliques going the other way. And then the deepest layer is the transverse abdominis, and they run like a corset across the front and low back, like that. Okay, so how to activating these are the ones you want to activate to do core workouts, really. I used to work in Killeen at a clinic where I saw a lot of people in the Army, and they were coming in with back pain and urinary retention. These guys, a lot of guys, women too, but a lot of guys with those symptoms, because they had to do all these sit-ups every day, and that was just strengthening their superficial rectus abdominis muscles. They had no deep abdominal muscles, and it actually pulled their body into like a position like that. And so their back, they had no stability in their spine and too much motion in one direction. So for you, if you're going to do anything core, even if you're lifting weights, if you're doing bicep curls, you're still activating your core so that you're not like every time, right? So when you activate your core, I don't want you to think about, especially if you're doing like something on your back and you're doing some sort of core workout, your belly button, here's the rule of thumb, your belly button should go down. If you feel your belly button pooching out, boop, when you're doing core workouts, you're overactivating the wrong muscles, okay? So if you can do it with your belly button staying down, it means it's not too hard for you. So how to activate? So relaxing your stomach, you might do this laying down if you can do that quickly. If not, you can do it seated. So relaxing your stomach, and then bringing your belly button to your spine. I don't know if y'all can see that. So that's relaxed. Belly button to spine is just a little movement inwards. And I can actually still breathe here while I hold this in, okay? When I do that little bitty contraction in, it supports my back. When I'm standing for a long time, when I'm sitting, when I'm working on people, I use that belly button to spine to support my back. That's called the transverse abdominis. That's how you activate it. Super important to understand. Practice it. The idea is belly button to spine. You don't want to feel it pooch. And it shouldn't feel like, can't breathe, right? It should be gentle, like do less. It should be gentle, lowering, slight tension. You should be able to breathe normally. Just a nice thing to know for life. Yeah.
And we had a participant say, thank you for these exercises. They have both types of incontinence, which I feel like happens.
Mm-hmm.
And then they had cancer, cervix cancer and hysterectomy, bladder prolapse repair, just a lot going on. So she's very thankful for these exercises.
Yeah, you're welcome. Yeah, the prolapse thing, oh, I guess it was repaired. So yeah, hopefully you're not having issues with that repair. I've seen a couple people recently who lost sensation after a repair and their muscles aren't in the right place. Anyway, it's left scar tissue. So, but there's a lot of people who don't have those issues. Hopefully you're one of those who has things better now. Okay, so I think that's as far as the exercises go. Or not quite. I'm going to give you one more. Actually, we're almost out of time, aren't we, Rachel? We have 1 more minute.
Yeah, we have about 5 more minutes, and then we can do 10 minutes to do questions and close it out.
Beautiful. Side note about exercise, we lose muscle mass at 0.7% per year, starting in our 30s or 40s, okay? So menopause transition accelerates this loss, and then it evens out again. So muscle loss leads to decreased metabolism because your muscles are using your calories. It leads to increased fracture risk and risk of arthritis. It leads to increased risk of a lot of issues, including cardiovascular ones and depression. And it can lead to pelvic floor issues like incontinence and prolapse. There's other reasons for prolapse too, but sometimes that's the cause. So exercise, including strength training, can greatly improve your menopause reality because it can help all of these issues. So anyway, just wanted to put that out there. So colorectal cancer is not specific to menopause, but many of you may have dealt with these issues, like I said earlier. Constipation is a big one, so I'll kind of go over that real quick. Treatment, similar to that for urinary incontinence as far as pelvic floor strengthening, and especially if you're doing that front and then back. So like I said, you might focus on the back ones. If you're not having any urinary leakage, really make sure you can feel the sphincter on the outside contracting and relaxing appropriately. So if you're having constipation, there's a whole, I think I have time to talk about this because this is the last thing. Yeah. If you're having constipation, there's so many reasons why that could happen. A lot of people are on pain meds and it's causing constipation. People undergoing chemo treatments can be having diarrhea, and then you go on medication to stop the diarrhea, and then all of a sudden you're constipated. Menopause, people in menopause tend to have more and more difficulties with constipation too. So there's a lot of factors that go into it. Generally, I'll tell you, there's a little protocol that I teach, and this is going to be my last bit for you because, we can all use this information, right? All right. So you have, there you go. You have your large intestine. It goes from, I'm mirroring you, but it goes from the right up, over, and then ends on the left, and then the rectum is in there. So there's a thing called the gastrocolic reflex. After a meal, your muscles around your large intestine squeeze and allow for, more space for more food. So that reflex is strongest in the morning after your morning meal. So I'm just going to tell you what helps a lot of my patients, and you do with that what you will. A thing that can help that reflex occur is a warm, fiber-rich meal in the morning. So that's the best thing for so many people is warm oatmeal, right? And you put some good fruit in there and some nuts in there. That's fiber, plus you get all kinds of other benefits from the nuts especially. And then, so you eat your warm, fiber-rich meal. Maybe your cup of coffee isn't going to hurt your bowel movements either, probably help you. And then you do this little bowel massage. So simply, you start on the end. So I'm on my left side below my rib, and I'm just going to make circles on my belly until I get inside the pelvis, and then I'm going to do it again. So I make circles 3 to 4 times, going straight down. And then I'm going to come across from rib cage to rib cage, bottom, and I'm going to make circles coming across. Obviously, if you've had any recent abdominal surgeries, you don't want to do this, and you're going straight down. So I'm going to go do that one now 3 to 4 times. And then I'm going to start at the bottom on my right and start inside the pelvis and come up. My torso is tiny. That's why there's not a whole lot of space here. And then over and then down. So you're helping that reflex happen. You're helping that the muscles, you're kind of starting the reflex, especially if you have constipation and there's maybe some stool burden in there. You are helping that reflex occur so that you can hopefully have an urge after this. So then you sit on the toilet. A squatty potty is really helpful. Stick your legs up on the squatty potty so that you're in a good angle. You have a good angle to defecate. And if you're having a hard time, don't strain. Try this. So right now, even if you're sitting with nice straight back, you're imagining you're blowing out like 100 candles. So I'm restricting my airflow through my mouth and blowing out. You might feel your pelvic floor drop towards the chair. I hope you do, because that can help with constipation, especially if you have a lot of tension in the muscles. If you can get them to drop, that's better. Also, if there's pelvic pain, this can be a tool during penetration so that there's no pain. Okay. And that's that. I'm done. Questions?
Thank you, Erin. We have a couple people that just let us know they missed last week and they're excited to rewatch that one just to see what you also said there as well. Do you mind moving the mouse and then switching it to the Q&A? Thank you. All right. So I'll go ahead and start off with a question just to get everyone else in the mood to ask questions. You guys are welcome to message me directly if you don't want to share your name with your question, or you can just ask in the chat or unmute yourself, whatever's easiest for you guys. The first question I have for you, Erin, is how do you discuss with your oncologist about whether you're struggling with incontinence or constipation?
Yeah, a lot of them won't ask you. I mean, they often ask about bowel or bladder, or at least I see that in their notes. I would just tell them, say, hey, I mean, sometimes you have to tell them what's going on. Hey, I am having constipation. What do I do about that? Hey, I'm having leakage. What do I do about that? And some of them may be familiar with pelvic floor physical therapy, but they might not. So you might have to offer it up. Hey, I went to this talk the other day from a pelvic floor physical therapist. Can you refer me to one? Or put an order in for that, and someone might have to you might have to do research to find a pelvic floor PT in your area. But, they might, if it's constipation, they'll probably prescribe you some sort of laxative. If it's leakage, they might refer you to a urologist or something. So I'm just saying, not everyone knows about our existence. So since you now know about our existence, I would kind of just ask for, if you think that this stuff could help you, I would just go ahead and ask for a pelvic floor referral, because we do have to have referrals from doctors for you to see us. And I have mine, if you're in Austin, I do have like a 2 to 3 month wait for my initial evals right now. So FYI, but if your physician will fax a referral to that number right there, then that's how you can come see me.
Thank you. Another question I have is, how can someone prevent urinary tract infections if I have incontinence? I think we've all heard the cranberry pills and cranberry juice. Is there any other ways that you can help yourself with that?
Yeah. If you're having incontinence, especially if you're wearing like some sort of pad or something, your tissues are just, they're around that bacteria a lot more. So it is easier to get those UTIs. So, obviously getting rid of the incontinence would really help. But if you, in the meantime, trying a barrier cream, which I thought I had one. Oh no, I do. So this, hold on. This is a barrier cream, Catalon, that will help to protect the tissues. So if you put it like around the vulva and entrance of the urethra, it can help to protect the tissues so that they're less likely to kind of get, if you're constantly you're contacting urine, then your tissues are always wet, and that can make them more brittle. So then you're kind of rife for bacteria. So this will help protect them so that that's not the case. I've also, FYI, had patients with pelvic pain who their muscles especially after an orgasm, their muscles did not relax, and that can actually lead to UTIs. It's almost like it sucks in bacteria and doesn't let it out. Thirdly, medically induced menopause, if you're having menopausal symptoms and vaginal dryness, those little micro cracks in the vagina can also be rife for bacterial, bacteria going in there. So look at the talk from yesterday about all the things to moisturize and get your vaginal vulvar tissues healthy. Okay.
Yeah, we'll have that recording. You guys received it in an email last week, but if you can't find that email or anything, feel free to reach out to me. I'm happy to forward it to you guys with all the things that we've done for the past 2 weeks. You'll also receive another email today with this recording in it. So, Erin Dean, do you have anything else for us today, or can we close it out?
You're not alone. Okay. And it's not shameful. And just because people aren't asking you about this doesn't mean that you're not worth getting treatment for it. They just don't know. So I tell my son when, anyway, it's a story right there. They just don't know. So you can do the education for them. Like, this is what I need. And know that like 70, I have a PA that told me like 75% of her breast cancer patients have libido issues and some pelvic pain. So it's really common. So reach out and get what you need. Okay.
Thank you, Erin. I appreciate you. Thank you all for participating with us today. Just a reminder, the session was recorded and will be sent out to all registrants, and it will also be available on our Canvas website. That's going to be open for the rest of the month. So if you have logged into Canvas one time, you have access to it for the rest of the lifetime of Canvas. So make sure that you sign into that once. After we close the Canvas course, if you haven't signed up for it yet, you will not have access to it. So make sure you sign up for it at least once, and you're able to see all of the recordings we've had for the past 2 weeks. Don't forget to head over to the discussion post for this week, and we're going to open up a little bit more about what we learned on our session today. If you have any questions that pop up, or you go through the handout and you're just like, wait, this doesn't make sense, feel free to ask those questions in the discussion post for this week. This is our last workshop for the past 2 weeks. So thank you so much. I love seeing the names over and over again, seeing everyone participating with us and kind of building our own little community here. Make sure to like our Facebook page and follow us on Instagram and stay current with our foundation. We will be doing another virtual experience with different workshop leaders. We might have Erin come back as well. Make sure you follow us on our Facebook page so that you can see when signups for that happen in August. And lastly, we have our our Survive and Thrive conference registration is up. So if you loved the past 2 weeks, now imagine it in 2 days, because we are going to do September 28th and 29th, have education on a ton of different topics, including sexual libido and incontinence, and we're going to have pain management. There's just so much there. So make sure you look out for our emails or register online for our conference. And it's free right now until August 1st. It's going to be $25 after August 1st. So make sure that you sign up early so that you get the free portion. Joan, I saw that you have a question of the name of the Facebook site. Facebook is just Texas Oncology Foundation. You're welcome to like Texas Oncology as well, but Texas Oncology Foundation is ours, and we will be able to, you just like the Facebook page or the Instagram page and you'll see our updates from there. All right, thanks everyone. I hope you guys have a great weekend. Bye y'all.